Hello, everyone. I'm Dr. Neha Narula, family physician here at Stanford Healthcare.
And I'm Dr. Olga Goldberg, a comprehensive neurologist at Stanford. Thank you so much for joining us on this educational collaboration between the Department of Neurology and the Department of Primary Care, made possible by the Value Based Care Program.
Our goal in these talks is to take a deeper dive into the most common neurologic complaints that we see in primary care and present the latest evidence based pointers that you can use in your own practice.
Joining us on this episode today is Dr. Lisa Smirnov from our headache division, who will be giving us advice on over the counter medications for headache.
Thank you so much for having me.
As we all know, over the counter medications, or OTCs, have been a staple of migraine treatment, with many of our patients relying heavily on NSAIDs and acetaminophen to alleviate their migraine headaches. So the question is, do over the counter medications really work for migraine?
This is a really common and frequently sought out question. There are a number of over-the-counter options that have shown level A evidence against migraine, including acetaminophen, aspirin, ibuprofen, and naproxen. Critically, these need to be used at effective doses, as shown in the table here, no more than 10 days per month to avoid medication overuse headaches.
Fantastic. This table also looks great. Thank you for sharing. I'm so glad to have specific options for my patients to try. A lot of my patients also like to use Excedrin migraine and its generics, which are combinations of acetaminophen or aspirin and caffeine. Is there any reason to be cautious with these specific ones?
The combination of acetaminophen, aspirin, and caffeine can be quite effective in patients, especially those who have migraines very infrequently. In patients who tend to have headaches more than a couple of times per month, there's even more significant risk of medication overuse headache, so you want to be careful about that.
I want to highlight that we want to be more stringent with combination medicines with caffeine and recommend using them no more than 6 days per month.
Got it. Okay. Thank you for sharing. What are the considerations in using these medications for migraine?
Well, let's talk about some pros and cons. The pros of over the counter medications are that they're often inexpensive and accessible to patients without requiring medical evaluation prior to starting.
Likewise, they have been evaluated previously by numerous studies for the treatment of migraine and have been shown to be quite effective for many patients.
Yes, and that's typically what we hear anecdotally from our patients as well. But it is important to look at downsides as well. Would you mind sharing some of them?
Sure, it's important not to forget that even though it's over the counter, acetaminophen has risks. Since it's typically not effective for severe attacks, patients may run the risk of taking more than the 4,000 milligrams per day allowance, which can put them at risk for liver damage both in the short and in the long term.
Outside of acetaminophen, we have to be cautious with NSAID use, especially in patients with reflux, history of gastric ulcers, or those who are increased bleeding risk, including patients on blood thinners.
Also, all of these medicines are available only in oral form, so they may be less effective than non oral formulations.
And while some patients can get by with only over-the-counter medications and may never need a prescription medicine, it's really important to keep in mind that triptans are safe and effective in most patients and should often be considered sooner to treat headaches which aren't responsive to over-the-counter medications.
Got it. Thank you. Wow, this was a fantastic overview, Lisa, of over the counter options for patients with migraine.
Thanks so much for having me.
And thanks to our viewers. We hope that you can join us as we explore other topics in neurology. Till next time.